Hello, Oak Park family. We are in the final phases of reopening and can't wait to say a big old welcome back. Before we do that, there's a few things that we need to review. First, we need to talk about COVID-19, or better known as the coronavirus. We want to make sure that everybody knows what it is, how it spreads, symptoms of COVID-19, and what we can do to help prevent it. Finally, we want to review what we will need to do moving forward once we return to work. COVID-19 is an illness caused by a virus. Symptoms range from mild to severe and impact the respiratory system, so much so that it can even cause death. COVID-19 is spread from person to person. This includes respiratory droplets from coughs, sneezes, and talking, also touching infected surfaces, then touching your mouth, nose, or eyes. Let's talk about the symptoms that we need to pay attention to moving forward. Those symptoms could include cough, fever, chills, muscle pain, shortness of breath or difficulty breathing, sore throat, new loss of taste or smell, and even gastrointestinal symptoms such as nausea, vomiting, diarrhea, or loss of appetite. Let's talk about prevention. As much as you can control, stay at home, especially if you're not feeling well. Try your best to limit your outings to essential things only, such as going to the store or going to work. Keep 6 feet of social distance when possible or functional. Wash your hands frequently for at least 20 seconds. Wear a cloth face mask in public when you cannot social distance. And make sure to disinfect surfaces daily and frequently. Let's be honest, things are going to be a little bit different when it's time to come back to work. The first thing we've done is put a big emphasis on safety. We've asked all of our staff and support services members to review and acknowledge an oath of safety so that we can stay safe to help you stay safe. Before you come back to Oak Park, we're going to need to make sure that you're capable of doing a few new things on your own. First, you'll need to be able to wear a face mask and keep it on most of the day. Second, you'll need to be able to follow social distancing rules. That means staying at least 6 feet apart from one another as much as possible. This may be hard for some of you who are used to greeting your friends and support staff with hugs and high fives. Third, we'll be asking everyone to wash their hands more frequently than they used to. It will be important for you to be able to wash your hands according to the recommended 10-step process. Lastly, we need everyone to have a focus on cleanliness. That means practicing good personal hygiene both at home and at work, as well as being able to wipe down your own work areas and throw your trash away. Please make sure that you, your family, and your care providers work together to discuss if you're going to be able to meet these new requirements before returning to work. And if there's any concerns at all about meeting these new requirements, then now is the time to start practicing. Please make sure that every day before you come to work, you check yourself against the COVID-19 symptoms home self-assessment. And every day that you do show up to work, we're going to ask you a few questions about those COVID-19 symptoms, and then we'll check your temperature and make sure you're healthy for the day. Face masks will be required in the building at all times or when social distancing is not functional. Face masks and some other type of barrier or shields will be required when traveling with more than one individual in a vehicle. We will ask that everybody take a clean-as-you-go approach. We want pre- and post-disinfecting of your workspace or the vehicle. This should be happening daily and frequently. And all of our traditional PPE or personal protective equipment rules will remain in effect, with of course some additions such as face masks, as we've mentioned, and for those who have janitorial job duties, we will be requiring aprons to be worn while cleaning in those areas. We truly look forward to seeing you all again and can't wait to welcome you back. If you have any questions, don't hesitate to reach out to your support staff, your case manager, or even any of our program managers. And we'll see you all soon.